Good morning, everyone. My name is Dr. Karthik. I'm an ENT and a head and neck surgeon working at TX Hospitals. Today, I'm going to discuss about some interesting topic, which is nothing but a sleep apnea surgery or obstructive sleep apnea. So, generally, whenever patients come to us with recurrent snoring episodes, recurrent apneic episodes means apneic episodes is nothing but difficulty in breathing during nights or waking up frequently in the nights. Because of that, their quality of sleep in the night decreases, and during the daytime, the patient tend to sleep a lot, and while driving, they tend to fall asleep, and they feel excessively tired during the daytime. So, whenever such patients come over to us, generally it is evaluated by a multi-specialty department, that is nothing but a pulmonology and the ENT point of view. In ENT, generally we examine the nose, if at all there is any structural or a fixed abnormality, and the next level of obstruction is at the level of the throat. Generally, in patients with obstruction at the nose, we evaluate by getting a scan done. A simple CT scan will give you a good enough result to know whether the patient is having any deviated septum or any sinusitis. Based on that, we'll address the issue accordingly. The second most important thing is evaluation of your throat. In that, it's a flexible obstruction. Generally, examining the throat is a flexible obstruction. In that, you do and evaluate it by doing something called a dynamic MRI. So, dynamic MRI is nothing but during your breathing, we'll do an MRI, and based on your breathing and based on your sleep pattern, we'll know the exact level of obstruction. So, those are the two investigations which we advise to know the extent and the severity. And the initial sitting, we do a simple sleep apnea scoring. So, based on that, you'll actually have a rough idea of the severity of the sleep apnea. And the third thing which we do is getting a sleep study done, which is nothing but a polysomnography. This is a simple test where a technician only comes to your house, and then they'll evaluate the entire night, how is your sleep and all. Based on that, they'll generate a report. Based on the severity and based on the extent of the disease, your options are discussed with you. So basically, you have two options. One is using a CPAP or a BiPAP. The second is a surgical option, which can be evaluated in a younger individual who can tolerate the surgery pretty well. That is nothing called as a multi-level sleep apnea surgery.